Surface. You have go through the mandible. So lower border and medial surface, and from here, this is the origin of masseter. From here, from the lower border and from medial surface. Clear? So here lies the attachment of masseter. Masseter is important because muscles of mastication. This masseter, temporalis, lateral and medial pterygoid. These muscles are important. Muscles of mastication may come as shortcut. Okay. So this one is the attachment of masseter. Clear? And the lateral surface is subcutaneous. Just lies under the skin. You can feel it. Okay. So this squamous part, external surface, internal surface, superior border, anterior inferior border. Clear? Features of external superior border attached to the squamosal border of the parietal bone. Anterior inferior, it is greater wing of the sphenoid. External surface feature, suprametal crest,
above
suprametal triangle and suprametal spine. Okay. Now internal surface, it is known as, this feature is known as petrosquamosal feature, and here lies the petrosquamosal sinus, and this group is called parietal frontal branch of interstitial artery. Here lies the temporal lobe of brain. This process is zygomatic process. Anterior part and posterior part. Posterior part is triangular. The superior surface is concave. Okay. And the inferior surface of the anterior root, posterior. Anterior root is known as articular. Posterior root is guarded by a tubercle, and the posterior part postvenous tubercle. Both meets at a point that is known as tubercular zygoma. This zygomatic process of the superior border attachment of galea pneumatica. Inferior border and medial surface, masseter. Lateral surface is subcutaneous. Okay. Now come to the mastoid part. This part is known as mastoid. These parts which have less information, this is important. Or those parts which have more information, you have to get a gross idea. Because whensoever you are going to the lacrimatory pathway, how lacrimation happens, parasympathetic pathway. So you have to go through some nerves. That is greater superficial petrosal nerve. So greater superficial petrosal nerve and deep petrosal nerve, it is the forming of nerve to pterygoid canal. Already discussed during the sphenoid. So if you have the idea, nerve to pterygoid canal, from the pterygoid canal, it comes into the pterygopalatine fossa, pterygopalatine ganglion. Clear? From there, zygomatico-temporal, from zygomatico-temporal, it is lacrimal nerve and supplies the lacrimal gland. Okay. So this pathway, lacrimatory pathway, secretion of the parotid gland, secretion of the submandibular gland, secretion of the sublingual gland. So this pathway may come. So if you don't know the location, at least the idea of the nerves, from where it enters, how it is forming the plexus. Okay. So for the idea you have to know, but don't go through. But this mastoid part is very important. This portion is the mastoid part. So this portion is the mastoid part. This portion is the mastoid part. Okay, so mastoid part have a superior border, have a superior border and a posterior border. So have a superior border, have a posterior border. Superior border means it is the parietal bone. Inferior border means it is the occipital bone. So superior border attachment of parietal bone. In posterior border it is occipital bone. Have a internal surface, have a external surface, and have a process. Clear? So internal surface. So this is internal surface. Internal surface have a groove. In this one is the transverse sinus. Thereafter it is sigmoid sinus. Thereafter internal sinus. So this group is for sigmoid sinus. This group is for sigmoid sinus. Okay. At this posterior border, you may get a foramen, mastoid foramen. at the posterior border you may get a foramen. This one is mastoid foramen. Okay. Here lies the posterior auricular artery, and here lies the sigmoid sinus. So here lies the posterior auricular vein. So emissary vein connecting the sigmoid sinus and posterior auricular vein. Posterior auricular vein. Okay. And meningeal branch of the occipital artery also goes through this mastoid foramen. These informations are not important. Clear?
Contents
देखते पाबे ना ये बोझ থেকে দেখতে এখান থেকে দেখতে this one after attachment this foramen. Okay, this one mastoid foramen. So the internal surface having sigmoid sinus, group for sigmoid sinus. Now external surface, this area have origin of occipitalis muscle, have extension of origin of the auricularis posterior. Okay, above it is Gallia-Aponeurotic. Okay, this process is known as mastoid process. At medial aspect, here lies the mastoid fossa. More medially, here lies the group for the occipital artery. So, tip of the mastoid process, mastoid fossa, and it is group for the occipital artery. Okay, clear? So this mastoid process laterally in this mastoid process, here lies three muscles. Rough page. Here lies three muscles. S, L. Sternocleidomastoid, this muscle, ultimately mastoid, splenius capitis and longissimus capitis. SSL. And this part. So what are the muscles that is the attachment of the mastoid process? This is important because externally, laterally SSL. Sternocleidomastoid, semispinous capitis and longissimus capitis. In the medial aspect, here lies the mastoid notch. Or digastric notch. So digastric notch you have in the mandible. Here lies the digastric notch. So from here, this one is the muscle. So anterior belly of the digastric, posterior belly of the digastric. So this muscle is the digastric muscle. Anterior belly of the digastric at the digastric fossa of the mandible, and posterior belly attached at the mastoid notch. Clear? More medially, it is a group for artery, that is for occipital artery. Clear? So mastoid part have a superior border, posterior border. The superior border with the parietal, posterior border with the occipital. Internally it is sigmoid sinus. Okay. Inferiorly it is mastoid process. This mastoid process and this mastoid part, above it is lies the occipitalis origin of occipitary muscle, and more above it is Gallia-Aponeurotic. At the lateral aspect of the tip of the mastoid process, here lies the attachment of SSL. Sternocleidomastoid you have to answer. Semispinalis capitis and longissimus, splenius capitis and longissimus capitis. Okay. Medial aspect it is mastoid notch. Here lies the posterior belly of digastric, and this one is the occipital artery. Tip of the mastoid, this one is the notch, and this one is the groove for the occipital artery. Okay.
digastric notch. আর এই সাইডের ছোটটা হচ্ছে অসিপিটাল আর্টারির জন্য গ্রুপ।
Now we have three part left. One is petrous part, one is tympanic part, and one is styloid part. Now come to the petrous part. Okay, this petrous part have a anterior border and anterior surface. Look at anterior border, anterior surface, superior border. Okay, anterior border, anterior surface, superior border, posterior surface, posterior border. So anterior border, anterior surface, superior border, posterior surface, posterior border, inferior surface. Clear? Remember like that. anterior border, anterior surface, superior border, posterior surface, posterior border,
inferior surface.
So at this anterior border, from this part you can see at the medial aspect it is attached with the sphenoid bone. At the medial aspect it is attached with the sphenoid bone. At the lateral aspect, anterior border is like that. At the medial, here lies the attachment of the sphenoid bone. But here, at the junction of the squamous part, and petrous part, here you can see two groups. One group is that, and one group is this one. So imagine the picture of the anterior wall of the middle ear. Above it is two group. Above it is tensor tympani. Below it is auditory tube. So this group is for tensor tympani, and this group is for bony part of auditory tube. So here lies the bony part of the auditory tube, and here lies the tensor tympani. This one and this one. This one is auditory tube, and this one is tensor tympani. Okay, clear. Now come to the anterior surface. This surface is anterior surface. This anterior surface is very important. Okay. Near the apex, here lies a depression. This one is trigeminal fossa. Near the apex, here lies a depression. Here lies the trigeminal fossa. So here lies the trigeminal ganglion. So from this trigeminal ganglion, near the apex, three division of the trigeminal nerve: ophthalmic, maxillary, and mandibular. Clear? Three division of the trigeminal nerve, and that goes through the foramens. You know from which foramen it is going. Clear? Here lies the trigeminal ganglion. So trigeminal nerve is very important. So cavernous sinus is very important. So you have an idea where the cavernous sinus lies, where the trigeminal ganglion lies. Okay. Thereafter this elevation is known as arcuate eminence. This arcuate eminence is meant for superior semicircular canal of internal ear. Internal ear is not important. So this eminence is for arcuate eminence, superior semicircular canal. Thereafter this is the roof of middle ear. This is tegment tympani. This portion is tegment tympani. In this tegment tympani part, you will get two small foramina, 1, 2. So trigeminal ganglia, arcuate eminence, and tegment tympani. In this tegment tympani, you will get two minute foramina, 1, 2. Two minute foramina, 1, 2. This one here like 1, 2. Okay. In this tegment tympani, you will get two foramen, 1 and 2. This one is lateral and this one is medial. Clear? From this tegment tympani part, two important nerve comes out. Getar superficial petrosal nerve, and laser superficial petrosal nerve. Laser superficial petrosal nerve is laser L for L. Laser superficial petrosal nerve is laser for lateral. It is lateral. This opening is lateral, and getar is medial. Okay. Laser superficial petrosal nerve is related with parotid gland, and getar superficial petrosal nerve is related with lacrimal gland and palatine glands and oral glands, nasal glands. Clear? So these two you have to remember. So the superior surface is very important. Now come to the superior border. Here you can see, here lies a group. At the superior border, this group is for superior petrosal sinus. So this group is for superior petrosal sinus. This group is for superior petrosal sinus. And this one is the attachment of tentorium cerebelli. So this one is the attachment of tentorium cerebelli. So this superior border have superior petrosal sinus and attached part of the tentorium cerebelli. So tentorium cerebelli, dural fold may come as long question or short note. So where lies the tentorium cerebelli, you know. So you can write down. Clear? Now come to the, this was anterior border, anterior surface, superior border, and this one is posterior surface. This posterior surface, here in this posterior surface, the important opening is internal auditory meter. It is usually covered by a bony septum, that is known as septum transversum. Clear? This septum transversum is dividing into four. This part is anterior, this part is anterior, this part is anterior. Posterior, anterior, posterior, superior, inferior. Clear? It is dividing into four. Anterior superior, anterior inferior, posterior superior, posterior inferior. Clear? From this anterior superior part, facial nerve. Clear? From this anterior inferior part, it is cochlear nerve. Anterior superior, it is facial nerve. Anterior inferior, it is cochlear nerve. Tractus foraminus spiralis. Okay. Clear? So anterior superior, it is facial nerve, two root of the facial nerve. Anterior inferior, it is cochlear nerve. Okay. So posterior superior and posterior inferior, two division of the vestibular nerve, superior division and inferior. So internal acoustic meatus, you have to identify the internal acoustic meatus is a very common OSPI question. So you have to identify the internal acoustic meatus from this bone, this one and this one. You all have to identify internal acoustic meatus.
Internal to
internal acoustic meatus. This one is tuberculum juguli. So at the level of tuberculum juguli, from above to downward, internal acoustic meatus, jugular foramen and hypoglossal canal. Tuberculum juguli, at the level of tuberculum juguli, from above to downward, internal acoustic meatus.
बोले दिखे दिखाते हैं सर इधर दिखाएं सर एक बार
tuberculum juguli, at the level of tuberculum juguli, internal acoustic meatus, jugular foramen, hypoglossal canal. Okay. So internal acoustic meatus you have to know, and behind the internal acoustic meatus, behind the internal acoustic meatus, here lies the aqueduct of vestibuli. Aqueduct of vestibuli. This one is the aqueduct of vestibuli. This is not important. Okay. Ductus and ductus of endolymphaticus comes out from here. Okay. So this one is aqueduct of vestibuli. You have to identify this one. Aqueduct of vestibuli.
Oh, a part.
Here lies aqueduct of vestibuli. Internal acoustic is just behind that. Okay. So this one is aqueduct of vestibuli. Now this one. This was anterior border, anterior surface, superior border, posterior surface, posterior border. This posterior border. This one the posterior border. this posterior border at the anterior part, it is attached with the
inferior pit.
it is attached with the
lateral border of base of
it is petrosal process of the sphenoid and lateral aspect of the base of clear, and behind it is a jugular fossa. Jugular fossa. Along with the occipital bone, it is forming the jugular foramen. So this portion is jugular foramen, and this one is attached with the petrosal process of the sphenoid and base of and this part is jugular foramen. This portion is jugular foramen. Clear? This one is posterior border. This part is attached with sphenoid bone. This part is attached with occipital bone. And this portion is jugular fossa. This jugular fossa was the floor of middle ear. Remember the picture. This jugular fossa is the floor of the middle ear. Okay. And along this posterior border, it was the superior petrosal sinus. Along the posterior border, it is inferior petrosal sinus. So from here, inferior petrosal sinus, here lies the inferior petrosal sinus, and this sinus drains into the internal jugular vein. So first tributary of internal jugular vein is inferior petrosal sinus, and last tributary is thoracic. Last tributary of internal jugular vein is thoracic. So internal jugular vein, the first one is not a vein, it is a sinus, and the last one again is not a vein, it is a duct. Clear? Now come to